respiratory. Can you have a seat, sir? Thank you. Tech, my name's Margaret. I'm going to be doing your physical today. Very nice to meet you, and thank you for coming to the clinic. Now notice I'm already headed toward the back. Now, this is what my eyes are watching. I see that his AP transverse diameters 1 to 2. There's no respiratory distress, so I'll verify that he's eugenic. Now here at the back, I'm looking for scoliosis. Thank you. And if you just turn as you did, that's perfect. There's no scoliosis, there's no kyphosis. Now let me know if you have any tenderness, okay? No parasternal, paracervical, no parathoracic. I don't know why I said parasternal, that was goofy. No paralumbar tenderness, and no sacral edema. Now what I'd like you to do is to take in a deep breath. Now notice how my fingers expand symmetrically, so chest expansion is symmetric. Now, could you say 99 for me?
99, 99, 99, 99, 99, 99.
So fremitus diminishes over the periphery, and it's coarser here over the big airways. Now I'm going to percuss. Now I'm going to find C7. He's resonant. Now, I know the gloves are making a funny little sound, but he is resonant. Don't worry. Now, take in a nice big breath and hold it. And could you cross your arms in front of you? Thanks. Now. Okay, so exhale and hold it. Oh, good. Okay, so you've got a nice diaphragmatic extrusion. It's within normal limits, 3 to 5 centimeters. Now I'm ready for breath sounds. Could you inhale and exhale through your mouth? Okay, so those are vesicular sounds, 3 to 1, very soft. Now between the scapula, bronchovesicular sounds, 1 to 1, medium pitched. Now below the scapula, vesicular sounds, 3 to 1, and I don't hear any crackles or adventitious sounds or wheezes. So I'm going to check for echophony. So if I thought somebody had pneumonia, could you say E for me?
E, 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 E.
So more than likely, I would hear an E to A change over pneumonia. Now, you can also percuss the kidneys. So there's no costovertebral angle pain. Now, if you could please lie down here. Great. Now, since I'm going to be doing the anterior, first thing I'm going to go for will be the neck, because I want to look at JVD. Now, don't go for the external jugular. We're going for the internal jugular. And his internal jugular does not rise above his sternal angle. So there's absolutely no jugular venous distension. Now, if you need me to locate that for you as I go around and work with your pairs, then we can find that. Now, for your practicum, you actually don't really have to auscultate the anterior chest for the breath sounds, but I will do it just so you know where to find it. So I'm going to actually locate the sternal notch and then the sternal angle. So above the clavicles, could you please take it in a deep breath? Okay, go ahead. Now at the second intercostal, I hear bronchovesicular sounds, and they're 1 to 1. And I heard above the clavicles, I heard vesicular sounds. Now here, over the right middle lobe, vesicular, and over the left lower lobe, left anterior lobe, I hear vesicular sounds. Now, I'm going to do my precordial exam, so I'm trying to find the point of maximal impulse. And here it is at the fifth intercostal space, it's 2 by 1. Now I move to the tricuspid area at the fifth intercostal space. Herbs area at the third intercostal space. Little pulsation is apparent. And then also I'll go to the pulmonic area at the second intercostal and finally the aortic. So I start my auscultation here. Now at the apical or mitral area, S1 is louder than S2. Same at the tricuspid. Herbs, S1 is greater than S2. Now at the pulmonic area, I can hear the physiologic split as he inhales, but S2 is now louder than S1. And here at the aortic area, S2 is greater than S1. Now I'll ask you a question about S3, S4 for an extra point. So for instance, if I ask you about S3, then you could tell me this is associated with heart failure, and you'll play me the little gallop. You'll say lub-da-dub or Tennessee or whatever you like. I think your book says lup-da-dub. So turn your stethoscope over and go back over the same pattern and let me know if you hear murmurs, S3 or S4. Now if I give you a question about S4, it's associated with ischemic heart disease and hypertension and an MI. And we have a low-pitched sound right before S1, so that's da-da-da, da-da-da. Good. Now, abdomen. Now, could you bend your legs for me? Thank you. So the abdomen is symmetric and rounded. I don't see striations, and the belly button is right there. Yay! Okay, right there. Now, I don't see striations or abnormal venous formations, so I'm going to start with auscultation. I start with my diaphragm. I hear vowel sounds. Now, I hear them in one quad. Don't go over all the rest. I know you do that. You would if you had to. Now, let's get the bell out, and let's listen to the auscultatory areas. So first of all, I want to locate where the aorta is. Now, it's right there to the left, or lateral to the umbilicus. Now, halfway between the rib cage and the umbilicus, we have the two renal arteries, which are really kind of along the extended midclavicular line. Now, below the belly button, but above the ischial spines, we're going to find our iliac arteries along the same line, and then finally the femoral arteries. Wonderful. Now, I go to palpation. I can feel the upward surge or pulsation rather, of the aorta, and no sideward pulsation. Aren't you lucky? That would be an aortic aneurysm. Now I'm going to do light palpation first. Does any of that hurt you?
No.
Okay, good. Now I'm ready to palpate the liver. Now I'm going to just help this. Thank you. Now, could you inhale for me? Exhale. Now inhale. Now no Murphy's, and hold that, and I can feel the liver border, and so that's how we palpate the liver. Now if we do the hook, inhale. Now this is Winley legs. Exhale. Inhale and hold it. Now which one was more comfortable for you?
The whole one.
Okay. All right. Now the spleen is really easy. Inhale. Exhale. Inhale and hold it. So there's no hepato or splenomegalia, and certainly no pain. Now I am going to do some deep palpation. Now this is when I like to chat with the patient, and you know, we would talk about Fox News, and we could talk about Iowa and all the wonderful candidates running, and who just dropped out? Who was that?
Plenty.
Was it Perry or Pauletti?
Plenty.
Okay, good. So I'm having a conversation with all the photographers. This is really good. So actually, I'm distracting him, and I was actually pushing in pretty far. You could feel that. That was actually deep palpation. So do you see it was a two-handed technique? All right. So we get all those areas. Now I'm gonna do percussion, which is my favorite.